So, good day, class. My name is Professor Jesse. I'm a professor of microbiology and global health, and I'm also an occupational health expert. For this semester, I'll be taking you the part of occupational health and safety. I want to believe that you have already had your time with Dr. Sibasi. If not, he will be taking you for the environmental aspect, but I will be limiting myself to the occupational health and safety aspect. For the sake of this course, we'll be looking at the following outline. So we probably will start with a general overview of occupational health and safety. Then we will try to understand economics and economic principles with particular attention given to economic development in the workplace. Then we outline some health issues that are inherent with our social, forestry, and environmental governance landscape. Then we will try to dissect economics and economics works hazard. We look at the health needs of some committees, occupational hazards, and how we can control occupational hazards. Then we will try to also understand accidents and injury prevention. Then we will end with revision. If we have the opportunity, then we will prepare ourselves for the end of modular examination. For the purpose of this course, these are some reading materials that I have outlined them for you guys to look for them and look through and see whether you can get them either in the library or the internet. But I'm thinking that it's much more easier to get them on the internet than the library. Normally, these are the assessment criteria that I use for all my courses. So people who would attend the lectures, I give them 10 marks. But in your case, because all of you probably are going to be having the lecture on recorded Zoom platform, I'll see if we get a chance to meet in person, then you can earn your 10 marks. I give assignments. Sometimes I do, sometimes I don't. But if I do give the assignment in their presentation, this is how they are divided. And then the end of model examination take this form. But in case we are not able to have the assignment done, I will still would calculate and then I would give half of my mark to Dr. Sibasi and he will take it from there. So the general review of the course. So occupational health and safety. The question that I normally ask when I start my first lecture with students for this course is that there must always be a reason where the course is taken. So why must occupational health and safety be a requirement for a social forester and environmental governance expert? It is very important because by the nature of the work that you guys do, for those of you who probably, because of your work, you deal with forestries, some of you are engaged with manufacturing, some others are also engaged with governance issue, then you must understand the hazard that goes with the job. I often tell my students that no matter how knowledgeable you are, if you do not have the right skill set in terms of good health, you will not be able to, as it were, dissipate the knowledge you have to people around you. And so this course is supposed to make you the social forester and occupational health expert aware of your surroundings by way of work ethics. And after doing your master's, become managers of your field. And so you will be in good position to also share the knowledge to people around you so you can work and work safe. And so we start off with economics. Economics. What is economics? If we were asked a rhetorical question, what is economics? What do you think? So we say it's a process of designing and or otherwise arranging the workplace, the products at the workplace and systems so they fit the people who use them. That's the definition that we have to give to economics. That's the definition that we give to economics. But it does not end there because most people are of the view that when you think of economics, it's only about safety or the design of a car control system, an instrument. But I would let you know that it goes beyond it. There are other factors that goes with this sitting arrangement in economics, that the experts in occupational health must also be made available so they can work safe and they can deliver as expected of them. Some also say it's a process of refining the design of product with the aim of optimizing them for human use. It is true. Products are made for humans, but they optimize. So there are some optimization that comes with height, weight, even the way you hear, your sight, and even temperature preferences. And all of these are believed to be well taken care of before human beings who use these systems can actually use them very well and get the responses there's so much need to be able to achieve the benefit. Some also say it's also known as the human factor engineering, and they are not wrong because we are trying to engineer human factors so the things they use is appropriate. So I've showed you some pictures that will let your thinking, the critical thinking portions of your brains. So as you see a person seated in that manner in the picture in the left hand corner of the slide, you have a rough idea. So as people who try to lift, so anytime you lift or you drop something, you must do them the right way. These are all economics. As you can see, these are people trying to lift tables, sofa, and you would be thinking that these are not economics, but they are. As you lift them, the way you hold them, you are putting strains at your spinal cord. You are putting strains at your waist. You are putting strains at your neck. And all of these can also cause damage to your body and they will affect the way you function as a manager. So we say economics and economic principles with particular attention must be given to economic development in the workplace. The idea is that people must function and they must function effectively, but you cannot function effectively when economic principles are also sacrificed. Let's look at some economic guidelines, especially the working posture. I believe all of you who hear the sound of my voice, you work, and as you work, you will sit in an office. And for those of you who are even students, you still sit to either write or either read. And so your sitting posture must be very good. Otherwise, you cannot sit for longer hours. If your job description expects you to sit for longer hours, and your sitting posture is defective, it affects the way you function. So we say when you sit, your wrist and your forearm must be held in a straight line. And this is done so you can reduce tendon and nerve stress. Then we're also saying that when you sit, your upper and your lower arm should be at the right angle. Should be at the right angle. So that your elbow is kept close to your sides, your head kept with a screen distance of between 25 to 48 inches. So you can have an optimal viewing angle, which is 20 degrees below the horizontal line. And these are agreed upon so that you can have an effective working posture. And this effective working posture will assist you to work and work effectively. Working effectively means that if you are supposed to work for a given number of time, you can be able to break that time comfortably without feeling any pain or the urge to stop in the middle of the discharge of your duties. Vision. One area that is also so important as you work is the way you see, because what you see informs what you do. The angle of your vision would always impact on your level of delivery. So we say what you see would inform your judgment. Okay? The vision you have on a regular basis inform your judgment. So your point of view will always affect your viewpoint. That is why you must see clearly when you work at the workplace. We also say that our eyes are the gateway to our system. We're able to see or we're able to get information to us because of our eyes. And for some people who are visually impaired, they have brains, and for them, their gateway is their fingers that they can use to touch the brain so that they can feel and they can translate. And so we're saying when you are viewing object, there must be no glare, especially when you are looking at a video display terminal or monitor. There must be no glare, if possible. If glares are unavoidable, use filters, and these filters is supposed to reduce the glare. If the intensity of your screen is also not appropriate, you are required to adjust them. As you watch on screens, we also advise to also engage frequent breaks from the screen so you can reduce stress on your eyes. This, in a way, tries to allow you to avoid optical illusions. General guidelines. As you work, you are advised to make sure you change positions, stretch, walk around if you feel tiredness. This is because if you sit for a very long time at one particular position, chances are that you'll be tired. There is also the general consensus that when you are using keyboards, make sure you go for light touches keyboard so you can also reduce stress on your fingers. You are also advised to rotate your eyeball and also concentrate on distant object and near object alternatively so you can also reduce eye stress. This will help you keep your vision intact. Those of us who wear glasses, we are also being advised that as much as possible, we must clean our glasses in addition to the monitors that we look at. And this is a picture of an optical illusion, which may look, which may be the same, but can be viewed differently because of strain that can build on our eyes sometimes. And these must be checked. And they are checked by going through the visual exercises that I spoke about, like making sure you're rotating your eyeball from time to time. You focus on distant and far objects, and this will assist you to be able to view correctly. The next thing I want to talk about here is handling. We handle things for different reasons. We handle our phones, we handle our bags, we handle our laptops, we even handle our loved ones. Those of you who are married who easily carry your wives, you handle them. But there are safety concerns. Although you are just handling, the handling can be safety concerns which must be checked. Now, every human being has what we call the vertebral column, which is designed in an S-shaped manner. And they are made up of discs, lying one on top of the other. And in between the disc is what we call the cartilages. Now, the cartilages are supposed to be preventing direct contact between the different bones lying up here. If you are lifting and you don't lift very well and you lift the awkward way for a long time, these cartilages that you see here can wear off. And as they wear off, the bone can touch another bone and it will come with severe pain. Some of you have been complaining about back pain for years and you've been using abonike and petrikeke. They only inactivate the nerves and the pain goes away for a long time. But the long-term cure is that you need to practice proper way of lifting. So much so that the cartilages that are worn can be repaired. Because as long as the bones are touching, you continue to feel the pain. You continue to feel the pain. So as you can see, most modern chairs that are coming, their back line is designed in an S shape so that the curved area of a spinal cord can lie on these chairs comfortably without any pain. Failure to do that will also cause pain. So we advise that we do the straight back line when we are lifting something. Make sure your back is straight, don't bend. Because as you are bending your back, you are pounding this bone on the one below. And as a result, the cartilages will be worn. And if the cartilages wear out, you will feel the pain. So how do we control these injuries? As much as possible, as managers, when we are handling manually, we must be careful. No matter how light whatever we are picking on the floor is, as long as it's beyond a certain kg in terms of weight, they must handle properly. And we managers who are taking this course must also learn so that we can also advise our subordinates to also handle things correctly. So I've given you pictures of how these controls can be achieved. First of all, as much as possible, we should avoid manual handling. Simple forklifts can be purchased and they can be used. But there are certain instances that we cannot also handle using mechanical means. And in such instances, we must always consider the size before we try to handle. How awkward the size are. The shape must also be taken into consideration. And before we even lift anything, we must think. Now we are saying when we are lifting heavy objects, we split our foot apart, 2 feet or 1.5 feet apart. And then we lay the stress on our thighs, just as the gentleman is doing. So the torso muscle of the thighs is designed to withstand mechanical weight. Then you lift with your back straight, so you can avoid the bones in the vertebral column from pressing upon each other, and by so doing, causing injury. To handle very well, you've also been advised to bend from our hip while avoiding twisting our body, tighten our stomach muscles, but we should not stop breathing. Our knees must be bent. The load must be as close to us as possible. We lift with our legs, not the back. Whilst we keep carrying our loads, we must make sure we carry them not too long distances. But most importantly, we must avoid changing grips as we lift. We must also avoid jerking. The load must be deposited by bending the knees and keeping the back straight. This is how we prevent injuries whilst we lift. Do we sit? Yes. As I even give lecture, I'm sitting. And there are some of us who sit for a long time. They sit for long times. Our subordinates sit for a long time. What are the safety concerns? Now we are saying that when sitting, the sitting height must be adjusted so that the thighs are horizontal and the feet are resting flat on the floor. This is because blood is flowing when our heart is pumping. Some goes to our brain, some goes to our feet and our arms. Now, if you don't sit very well, blood flow to our extremities, especially our hands and our feet are truncated. So sometimes you feel numbness in your feet. And some will say, anansiacho, literally the numbness of the feet. And some even go to the extent of even buying medication. It is the way we sit. If you don't sit properly, blood flow to extremities are restricted, especially when we age. And once you do, you experience this numbness. You experience this numbness. There is extreme conditions where, because of heart-related problems, blood is not able to flow to these extremities. And there is occasional numbness or anansi, arresting your feet in your hands. But if you are okay, once you sit well, all these things will stop. Then the tight torso angle, we are saying it should also not be less than 90 degrees Celsius. It can increase though, but it can't also go beyond 100 degrees Celsius. Your chest should have backrest as much as possible. In occasional cases, we have lab chairs, but those lab chairs are used when you have lab sessions for 2 hours. If you're going to be sitting for longer hours, your chair must always have a backrest so that they can support the curvature in the lumbar area of your back, so you will not have back injuries. As managers, we know these hazards. How do we control them? I always say that knowing the problem is not enough, but having the right solution is what will make the right changes. Now, if you have an employee complaining of back pains on a regular basis, you must first of all see whether we can introduce medical intervention. But I feel before medical intervention comes in, there must be administrative. You must go around. Administration can give a rule that nobody must sit on a chair without a backrest. Then there is engineering. If the backrest is there but it's poorly adjusted, then it can be engineered to make sure that it fits the people who use them so we can control. Now, engineering controls include redesigning, good housekeeping, introducing ventilation, mechanization, especially in lifting and dropping. If this hazard cannot be changed, let's see how we can, if we cannot engineer them, let's see how we can try to substitute them with other ergonomic entities. If they cannot be substituted, let's see how we can enclose them. If we can't enclose them, let's see how we can isolate them. There are instances where we need to wear PPE so we can also protect ourselves from this hazard, especially working in an environment where it's so dangerous with loosely hanging wires. Then there's also statistical monitoring to see those who go through this and who need help. That is so much about economics. Now let's look at occupational health and what it is. Occupational health has to do with the health situation with the work we do. So we are looking at the health effect of the jobs we do on a daily basis. I want to believe that we are in different jobs. Except a few of us who may be students, and even the students, once you finish your work, I believe you will get jobs to do. And in those jobs, there are health hazards. So I define occupational health, supported by International Labour Organization, (WHO), as the promotion, not all. Once you promote, you also maintain the highest degree of physical, mental, and social well-being of workers in all occupations. The reason I add mental was that I want it to be total. There are people who are mentally not too well because of a lot of tension they are going through their workplaces. And this is also occupational health that must be looked at. So how different are they from occupational medicine? Is occupational health the same as occupational medicine? They are interrelated, especially when it comes to therapeutics. And so we say it's a branch of medicine concerned with interaction between the health of individual and the work that they do. But therapy is the assessment and the treatment to enable maximum independent function of an individual in their workplace for their daily living using purposeful activities designed by occupational health and safety experts. Then what therefore is occupational disease? What therefore is occupational disease? Occupational diseases are diseases that occur as a result of specific or strong relation to one's job or occupation with one or more causal agents. In the slide following, we'll be looking at one or two causal agents, which we must try to familiarize ourselves with the discharge of our work. So work-related diseases are also diseases that arise as a result of multiple causal agents. And we are saying these are factors in the workplace, and they may play a role either on their own or together with other factors. So they can lead to the establishment of diseases which have a complex etiology. On the basis of this, we have identified some diseases affecting the workplace population, and these are diseases that come about because of causal relationship with our work. And this may be further aggravated by occupational hazards that we find ourselves on a daily basis, and that can impact on our health. So these are a list of some of the occupational diseases. So we have the disease caused by agents, which can be physical, chemical, or biological. We have diseases caused by target organ system, which can be respiratory, skin, musculoskeletal, and we also have some that are causing cancer, especially exposure to asbestos, and these are known to be carcinogenic. They're able to cause the cells to behave abnormally with production of diseases. Hazards. What therefore is an occupational hazard? Occupational hazards are hazards that arise as a result of a given source or a situation. And this given source or situation has the potential for harm to come onto an individual in terms of injury or their health, and even go on to damage properties, workplace environment, or a combination of these. And I've given you this slide, these pictures, and the idea is that they talk about these occupational hazards once you cite them. Let's talk about occupational health, back to occupational health hazards. There are types of occupational health hazards that have been categorized into forms that include physical, chemical, biological, mechanical, and even psychosocial. The physical hazards that we find include how cold or how warm a given working environment is, categorized under temperature. Then the illumination status, noise level, vibration levels, radiation levels, and even the pressure levels. And all of these are categorized as physical hazards. Diseases due to this physical hazards include the heat, hyperplasia, heat exhaustion, heat syncopes, heat cramps, burns, and prickly heat. People living in temperate areas are also exposed to frostbites. At a full job description exposes them to bright light, are exposed to occupational cataract. Others are also exposed to kidney disease and even embolism. There are occupational deafness due to excessive noise. There is radiation causing cancer, including leukemia and aplastic anemia, and even pancytopenia. There is also exposure to electricity where people are either shocked or they are burnt. And these are the predisposing factors that make people engage in this health situation. Predisposing factors are factors that would engage or enable particular individuals to have particular disease. So assuming we have 100 people working in an area where these physical hazards are available, not all of them would have the disease condition at the same time, and some may not even have it at all. And the reason here is the predisposing factors: your age, your physical activity, the clothing you wear, how often you hydrate, your heart conditions, your weight, your drug use, and other things. So the chemicals. So these are also the chemical agents that can also predispose one to a possible occupational hazard. And those that are also exposed to dust. These are the diseases that we see here, from anthracosis to silicosis to even asbestosis. Those exposed to organic dust also have diseases such as bagaxosis, bichinosis, tuberculosis, and even farmer's lung disease. There are also some that are also exposed to biological hazards, especially farmers and even occupational sex workers. They are exposed to biological hazards due to the work that they do. And once you know these are the hazards, then you can find ways and means of controlling them. There are also mechanical hazards where people can fall. Concussions may also occur. Contortion may also be experienced, where there can be some musculoskeletal injuries or dislocations. because probably mechanically either a material hit you or you fell or something. Then there's also the psychosocial hazard that has to do with our emotions. Sometimes lack of job satisfaction, insecurity, and poor interpersonal relationship can also attribute psychosocial hazard, and they must be checked. There is the psychological and behavioral changes that can link to this psychosocial hazard, where a boss can be so hostile to his subordinates, where a boss exhibits excessive aggression, making the employee anxious, depressed. Some can also resort to alcohol use, and the psychosomatic disorders that may manifest will include hypertension, unexplained headache. Some will experience peptic ulcer because they don't eat. That could lead to diabetes and other health disorders. So the principle of workplace hazard must be controlled, and they might be controlled using what I call the IT or the ICE. So you have to identify the problem, then you evaluate. As we evaluate, you look at the strengths and the weaknesses, and then you implement controls. Your controls can come by way of eliminating the hazard, substituting the hazard, closing the hazard, or either using a PPE or even vaccinating yourself to make sure you can overcome the hazard. So we are saying hazard is also an existing or potential condition, hazard as it stands alone. And this can either alone or interaction with other factors can cause harm to an individual, and they come in different ways. So you walk in the factory floor, you see water spill on the floor. It's a potential hazard. You see a broken equipment, poor housekeeping. These are potential hazards that are potentially going to injure somebody. Some also block walkways. Some also don't walk where their PPEs, or even if they wear them, they are all damaged and they are all hazard conditions. These are pictures that hazard that are not controlled can lead to. Once we see them, it must also motivate the critical thinking portion of our brain so that our eyes is wide open to this hazard. Then risk. What is risk? We take risk on daily basis. By you going to work today, you took some risk. By driving your car, you took some risk. By even eating, you took some risk. But we are saying the risk must be measured. The risk must be measured. They must be measured so that we have more possible results of the risk, and that would give us the gravitas to be able to engage in them. So, for instance, if you were asked to go to Accra with a motorbike at 1 a.m., it's an obvious risk. But if they add that, if you're able to do that correctly, they give $1 million, you are more likely to forgo the risk, do that because of the incentive. So I define risk as a measure of the probability of a hazard and how severe this hazard is to cause harm to an individual, his health, his property, or even his environment. And if I check the probability, and the probability is such that I'm going to be having some motivation, then I will forgo the risk and then I will indulge in them. Some also define it as the measure of how likely a possible harm can occur to an individual, and an indication of how serious it is to also occur. This would also inform us to see whether we should take such a risk or we should forgo. But then nothing we do has zero risk. Everything we do has risk, except that the risk vary. Some are high, others are low. These are various risks other people are taking. The man you see up there is working on the rope. I don't know how much money you are going to be giving to him. But this is a risk I will never try, no matter how much money you put on such a venture. A woman is also trying to climb mountains. I don't know her motivation. But even the mouse at the bottom corner of the slide is so much smart to know that he's hungry. But in spite of how hungry he is, he needs his helmet so that even harm occurs to him, he is covered. Let's talk about safety. What is safety? Safety is defined as a measure of the judgment of an acceptable risk. So I know for sure that I have been asked to go to Accra driving on a motorbike at 12 a.m. It is very risky. But I have measured the master acceptability of risk because I know the benefit. And for me, that becomes my safety. We accept some risk because of the benefits that are ascribed to it. So politicians would take the risk of campaigning and spend a lot of money. They know very well that once they win the election, they can make a lot of changes to policies. And that one alone do not make venturing into politics risky for them because of the safety concerns that they harbor in their heads. And these are some pictures to throw more light on safety and safety concerns. So that takes us to accident. Accident. We cannot do occupational health and safety without looking at accident. But many a times, if you have ever traveled from Kumasi to Sunyani and back, that means you were likely to be exposed to an accident. But what comes to mind before we think of accident? Is it when you hear a crash or somebody calling fire, fire, or somebody saying, can somebody call 911? Or when you hear a boss saying evacuate, or when an ambulance is being called? Is that what we call risk or accident? Or sometimes is it also when we are just traveling and the driver is trying to overtake and he does overtaking and there was a near miss, then you scream, Jesus Christ, that was close. Is that what we consider the risk? Or when you say, driver, watch out, or wow, we almost hit, we were damn lucky. Is that what comes to mind when we hear of accident? But I came to tell you this morning that when you sit in a car and you begin to hear some of these things, then you must be sensitive to the environment. One near miss, the next one could not be a miss. One close save, the next one could not be a save. One lucky incident, the next time you will not be twice lucky. So we are saying you must be sensitive that accident is not too far from you. Therefore, what is an accident? An accident is one unexpected and undesirable event, especially one resulting in damage or harm. Especially, a car accident can easily occur on icy roads because probably the roads are very slippery. Or you can also have an unforeseen incident where you can accidentally be promoted. A soldier or a policeman going to work on his way sees a scene accidentally. He can become a hero, and by so doing, he can be promoted by accident. Or somebody can also be having an argument with you, and the person can give you a stupid slap. You can wee on yourself. You do not intend to wee. You wee by accident, or by lack of intention, you can also run into an old classmate at an airport, and that can be an accident. So we say not all accidents are negative. It depends on the way it happens. But for the purpose of this lecture, we will limit ourselves to accidents at our workplace and how they can be avoided. So we are saying we must always be proactive as managers. We don't wait until the accident comes and we are doing firefighting. It doesn't help. So well, accidents are always waiting to happen. But as a boss, almost looking around, as you can see, these are workers that are moving the factory floor. They've seen a leakage and they think that it is something that is laughable. But this is an accident waiting to happen. And once it does, somebody can get hit and that person can be you. So on this slide, you see three workers cartooned who are not taking their safety concerns well and they are having different deformities. Some of them have their eyes affected. others have their arms, others have their mouth. And this is happening because they needed to be sensitive about the environment. They did not, and they are paying the price for them. Sometimes you can also be walking, you will see banana peels on the floor. You think it doesn't concern you. Somebody can slip, and that person can either be your boss or yourself or one of the very important people in the company. And once they do, there could be consequences. There are instances where people are injured, and when they do, the work has to stall. There is loss of man hours. There is an extended working time. Sometimes there is a cost to the company. And so, as we work as managers, we must be looking around for safety concerns that comes so that we can avoid them. On that sense, we have listed some types of accidents that can easily occur in the workplace or even in our home. So we can fall to either the same level or lower below. It's an accident. It's an accident. If you slip, you slip on the floor. Your head can knock some wood or some block, and you can be seriously injured. Or you can also fall from a higher level to a lower level. You can also be caught in two moving machines, or you can also be caught on a moving machine, or even in between. All those things happen. Sometimes you can also have contact with chemical agents that can also cause harm to your body, electricity, heat, or cold, or even radiation. Or sometimes you can also have bodily reaction from voluntary movement or involuntary movement that can also cause an accident. So the slide you see here, this young man has fallen to the same place, but this young man has fallen to a place, a level below where he is. And in all of this, if you are not protected, you can be engaged in an accident, and the results could also be very dire. This young man has accidentally drilled the hand. The lady in here is caught in between. The man here has his fingers cut, and these are accidents that are so common, especially when safety concerns are often overlooked at our workplace, and they must be really looked at if we are managers who want to, first of all, work safely, and also want our people to work safely. Now, you can also be struck against a moving or stationary object. You can also be struck by a moving or flying object, or you can also be struck by a falling object. Sometimes you can also be rubbed or abraded by friction, pressure, and vibration, and all of this would cause injury to you. So the next point I want to talk about is that what are the causes of accident? That I list accident causing factors. There are many, and I will list a few. The pictures you see here, if you're a driver, you agree with me that you've fallen victim to one or all of them before. Especially when you are driving and then you are trying to eat. You are eating and both hands are covered. Sometimes you are driving and you are trying to check instant text messages on your phone. Normally, when you drive and you get to the zebra crossing, the straight line in front of the zebra crossing clearly tells you that you are not supposed to drive past it. Even if there are no cars coming, you must stop dead before you move. But many a times, people even drive into the white sections. There are instances where people even drive when people are even trying to cross. And all of this potentially can cause accidents. So I say there are three accident causing factors that must be known, and this must be prevented or eliminated so we can bring accidents on our roads or in our workplace to a minimum. Now we are seeing at the lowest level, an accident results only when a person or an object receives an amount of energy or hazardous material that a person cannot absorb. For instance, you can be walking on a factory floor, and a paper can fly, a paper can hit you. You can absorb that amount of energy the paper is carrying. But you can also work on the factory floor, and the wood plank can also fall and they can hit you. Because that wood plank carries more energy, you may suffer some harm because your body cannot possibly absorb that. This energy or hazardous material, we call them direct cause. The direct cause is usually the result of one or more unsafe acts or unsafe conditions or even the condition, a combination of the two. Unsafe acts and conditions are also known as indirect causes or their symptoms. So we are saying in turn, indirect causes are also usually traceable to poor management policies and decision makings or to personal environmental factors. So a manager can say, okay, now we have excess amount of wood to produce. Canada has placed an order. So because of that, we are going to forgo our breaks. Instead of we working at 9 and closing at 5, we will start at 6 in the morning and close at 10. We will be giving overtime. This is a poor management policy and decision. And by so doing, people can also be hurt. These are what you call the basic causes. So we say accident causing factors are basic, they are indirect, and they are direct. And under the basic causes, we link them to management decisions, the environmental conditions, the equipment that we deal with, and even the behavior of the people working the factory floor. Now, the indirect causes are more like acts and conditions. So the unsafe acts that we engage in, failure to not to wear PPEs, not creating a very conducive working environment can also cause indirect cause, but indirect can also link to indirect cause. But the direct causes are the normal slips, trips, falls, the cuttings, runovers, and chemical exposures that we are exposed to on regular basis. These are all pictures of accidents. You know, driving tired, driving stressed, slipping, and then you landing your fingers on a very hot object. Let's look at the basic causes. So the basic causes, like I said, they are linked to managerial decisions, working environment, equipment we need, and even the behavior of the people in the workplace. Why do managers, why do managers contribute to basic causes? It's the policy, just as I said, the policies, systems, and procedures they put in place. And these are decisions taken at the management level. And in institutions, once the management comes out with a decision, it must follow through. That is why we say the management team must have some members, even if they are not voting, members like occupational and safety, they must be part so that when they are taking decisions, they can use their knowledge to inform management so that they don't put in system and procedures. That can also cause basis causes for accident. Sometimes the environment, the housekeeping nature of the environment. Some of them are natural, others are man-made. Then equipment we use, how the equipment is designed, and even the behavior of the individual, how we deviate from the usage, how we behave at the workplace can also lead to some disease, some accident. So these are pictures of more accidents that are introduced into the slide to stimulate the critical thinking portions of our brains. How do systems contribute to it? Lack of the right system and availability of laid down procedures. Sometimes we fail to supervise, and all of this. The environment, sometimes the lighting, the temperature, the vapors, the smoke, and even the presence of some biological agents like reptiles and even bacteria can also lead to injury and accident can follow. Equipment design and housekeeping all play a part in this. Human behavior, how sometimes we think, and the actions we do, they are all common causes to the accident that we endanger ourselves to. Human factors. The man, I don't know whether he has a side mirror at his left hand side, looking at the woman and asking in his head whether the woman is married or not. But sex acts can easily lead to accidents if done on the road whilst you drive. Sometimes we also omit the appropriations of SOPs. Sometimes we also deviate using shortcuts. Sometimes we remove our guts, and some of these things can also lead to being involved in accidents. Let's look at the human behaviors as a function of accident as we get closer to the end of our lecture. So we say human function is made up of activities or triggers, then that dovetails on the competence of the people and that have consequences leading to accident. So I have labeled them the ABC model, where there is triggers or antecedents, and these triggers or antecedents have a way of impacting on our performances. And once our performance is affected, there are consequences, and these consequences must be reinforced by way of punishment if you really want to change some of these human behaviors that causes people to involve in an accident. Now, consequences are more like punishment or reward that comes due to behaviors. And as managers, if we want to change behaviors that also impact positively or negatively on accident, we must use one of four methods. We can either use positive reinforcement, where we say put on PPEs and you'll be rewarded at the end of the year. Or we can also say if you don't put on PPEs, you'll be punished. Or we can also say if you do this, you'll be penalized. Or sometimes you can also ignore. But as a manager, you need to choose the type of consequences that you need based on their job dynamics to be able to change human behavior that can also lead to change in attitude, and then that can also reduce accidents. You are saying consequences influencing behavior upon individual perceptions must be weighed. They must be weighed in the sense that if you look at the magnitude of the significance and then the impact, whether it will have a positive impact or a negative impact. Sometimes with the timing of the punishment is also important. People undertake unsafe act. Are they punished immediately or they undertake unsafe act and then we take our eye off only for them to be punished later? And how consistent we also are when it comes to some of this punishment. Do we do them on a regular basis or sometimes we turn a blind eye so um, the the act goes away? Now, researchers have come with the observation that behaviors that have consequences that are soon, certain, and positive have a stronger effect on changing people's behavior than those that come sooner. And that is the reason why people fail to ignore things like think the safe way is the best way than the stop um, sign. When I drive and I see stop, I immediately want to stop because I don't know why. But if you are asking me to think, then I'm more likely to forego this aspect and I'll be ready to face the consequences. So we say the consequences that follow soon after a behavior has a stronger influence than the consequences that occurs later. And we say silence is sometimes considered consent. So if somebody does something and it's not corrected, we have the perception that people agree to the things they do. So we are saying failure to correct an unsafe behavior can influence employees to continue the behavior till perpetuity. So we say a consequence that is certain to follow a behavior has more influence than uncertain and unpredictable consequences. Even your child, your 5-year-old son or daughter does something. Anytime he does it, he or she is punished. The person is likely to stop. Then when sometimes you punish, sometimes you don't punish. If you are dealing with a very stubborn generation, you are more likely not to have a very good consequences. And so we are saying corrective measures must be prompt, consistent, and persistent. And so we say a positive consequences is likely to influence the behavior more powerfully than the negative consequences. Example, it's not all the time that you punish, but you can also decide to sometimes reward. And that is why sometimes in a class where people are not speaking, instead of punishing people who don't speak, we can decide to reward people who speak by either clapping for them or by rewarding them with marks. And you realize that it is having a much more powerful impact than the latter. And that is why smokers find it difficult to stop smoking because the consequences are not immediate. They don't happen every time they smoke, and they also have a nicotine high. The other consequences are that even if they will get lung cancer, it comes later when they are very old. And in some instances, people smoke and they don't get any negative effect at all. And although there is a negative effect of lung cancer, some may even long dead before this disease even manifests. And so people kill smoking. Why do accidents happen? Sometimes we also deviate from SOPs, where we employ unsafe procedures. Sometimes employee didn't know how safe procedures are. Sometimes employees knew it, but they didn't follow it through. Sometimes employees were encouraged to use risk-taking methods, and sometimes employees also change the approved procedures. So the question that I ask, it's a rhetorical question. What will you do as a worker if you had to take just 15 minutes to put on your PPEs, to enter a room to turn off a valve, which took only 10 seconds? Here you realize that employees are more likely to forego this because they want to engage in risk taking. So we say punishment or threatening workers is a behavior method used by some safety management programs. But punishment only works if it's immediate, occurs every time there is an unsafe behavior, and this is hard to do. Let's look at some human behaviors. Some experts believe you can change human behaviors in terms of safety by just changing their attitude. You can, by just changing the attitude. So sometimes there is also the safety attitude captured from the accident report, and we believe that one, the attitude of workers are also varied. We can also change their behavior and they can also work safely. This is because attitudes are inside a person's head. Therefore, they are not observable. Neither can we measure them. But attitude can be changed when we try to change their behavior, the thing that we see them do. And by so doing, we can have a positive impact. And so we say attention behavior safety approaches is the way to go. Example, focusing on getting workers to pay attention is the best thing to do. Inability to control attention is contributing to factors that are making a lot of our employees getting injured. You cannot scare workers into safety focus with just pay attention campaigns. It's not enough. Let us decide to change their behaviors. And once we change their behaviors, the attitudes are changed, and then they can also limit the number of injuries. What are some of the reasons why our employees lose attention? Sometimes our phones, technology, sometimes also increased job stress caused by uncertainty, especially measures and downsizing. Sometimes we have lean staff and increased workloads. The the attention gets consumed because they are thinking. Sometimes fast pace of work, a lot of time to learn new tasks and to do familiar jobs safely. So we see work repetition can hold workers into a loss of attention, but low level of loyalty shown to employees by an over recognizing employer may also lead to disinterested workers, detached workers, inattentive workers, and what have you. Let's look at human behavior. So we are saying focusing on awareness is a typical educational approach, and this can be used to change safety behavior. But just focusing on attention, using just focusing, you just using attention campaigns alone is not enough, but there must be a step further of getting them educated. So we say you provide employees with a persuasive rationale for wearing safety glasses and wearing hearing protection in certain work areas. By so doing, we can reduce accidents. This leads us to developing safety, personal safety awareness. And we must do that by letting employees know that before starting any job, consider to do it safe. They must understand wearing PPEs and how to get used to it. They must determine the correct tools and ensure they are in good condition. As much as possible, from time to time, they must scan the area to know what is going on. As one should check his work position. Any unsafe act or condition should be corrected. We must remain aware of any changes in our workplace. We must talk to other people about safety, and we must also take safety home. Some top concerns that we must also arm ourselves as managers. Do you, as a manager or potential manager, want to work safe? Do you want others to work safe? Do you want to learn how to prevent accidents or injuries? How often do you think about safety as you work? How often do you look for actions that could cause or prevent injuries? More thought questions. Have you ever carried out wood without wearing gloves? Have you ever left something in walkway that was a tripping hazard? Have you ever carried a stack of boxes that blocked your way? Have you ever used a tool or equipment you didn't know how to operate? Have you ever left a desk or a file drawer open while you walk in an area? Have you ever placed something on a stair just for a minute? Have you ever done anything unsafe because I've always done it this way? These are all thought provoking questions. And it all borders on time. Sometimes we are too busy. Then we say, the boss wants a job done. So I must do it as fast as possible without looking at the safety concern. And these are stuff that take our attention from working safe and getting people injured. Sometimes we also rush through the job, working quickly without considering safety. Although it can save time, but accident can occur. But if the accident occurs, someone will get hurt, someone will get injured. The work may not be done at all, and that someone that is hurt can be you. And so therefore, we are being advised to comply to all these safety hazards so that once compliance is made, even if accidents are reported and the safety officials know that compliance was made, our punishment can be reduced. And this is the real cost of accidents. Let us finish by looking at the outcomes of accidents. So there are negative outcomes of accidents. They can also be positive outcomes. Let's look at the outcomes of accident, the positive outcomes. Once an accident happens, the positive aspect is that an accident investigation can be carried out, and this can prevent the repeat of accidents. There is improved safety programs, there is improved procedures, there is improvement in equipment design. Negative cost, negative outcomes. There is cost element. There is also indirect cost. Indirect cost can be people needing medical attention, insurance cost, lost time. Sometimes some are also fined. Then there is injured people, and then there is also lost time wages. There is people who may not be injured, but there will be lost wages, especially when the people have to work and be earning daily wages. When people are injured, the workload are increased, and there is overtime for people who are working. The supervisor will have to be employed, and that supervisor will take excess wages. Some bonuses may be lost. So for industry where they say if you're able to maintain zero incidents of injury at the end of the year, we give you such amount of money. Once injury occurs, such bonuses are lost. Employee morale is low. There is a need for counseling. Turnover time is also increased. There are instances where you have to employ or rent other equipment because the equipment is damaged. Some can lead to cancellation of contracts. Some can also lose their orders. Equipment may be damaged. There's the need for investigation team time who will be speaking to workers, and this will be listening to their time to work. Production is decreased. Light duty notice is activated. There is new high learning time. Administrative time is also at a cost. Community goodwill is lost. Public perception and customer perception reduces, and sometimes third-party still can also emerge. But I must also say that there is positive aspect, especially when accident happens. An accident prevention program can be kicked in, where they would investigate, and once they investigate, they can bring out modalities, and these modalities can lead to safety orientations, which orientation is supposed to make sure that future accidents are prevented. And I'm thinking this is where we would end our lecture on accident, occupational health, and safety. So, like I said, I'll see if you can meet one-on-one or maybe some short time on Zoom for some clarification. But I'm going to share this video with you. This video was made today, 26th of June 2025. It is intended for you. Listen to them. Once you listen to them, if there's a need for us to meet again, we'll meet. I also will share your slide with your course rep so that we can have access to them. All right, thank you.